Hi there, it's pharmacist. I'm from Weiser at the University of Pittsburgh. I want to talk to you today about engaging adult learners in healthcare simulation, how to make it more efficient, how to make it more effective. Let's go. Hi there, it's Paul Frampus. I'm the director of Weiser at the University of Pittsburgh. I wanted to talk to you a little bit today about the engagement of adult learners in simulation. Most of us working in healthcare simulation have a population of participants that are super smart people. I mean, they are really smart. Whether we're talking about the students of healthcare, perhaps at a nursing school, medical school, pharmacy school, or they are practicing folks that have 20 years of experience. Nonetheless, we're dealing with a seriously smart crowd. And we need to think about how can we best engage them in simulation. There's a few things to think about from the very beginning. One is maybe they have some angst about you watching them. Maybe they have some angst about simulation itself. Maybe they're uncomfortable with the process. Maybe they don't know the process. So what kinds of things can we work on, or what kinds of things can we do to create a successful educator to participant learning environment for them? I think there's 5 big tips that I can give you right off the bat. I think starting off with letting them know what you're about to experience is not real. We don't want you to think it's real. That's okay. We just want you to think that what we're doing will help you get better as a healthcare practitioner. We have lots of ways that can happen. We reinforce the things that went well, and we explore the things that you might want to change next time that you see this patient and how you can improve as a healthcare provider. After all, healthcare, all of us in healthcare are engaged in a lifelong learning contract. The second tip, number 2, I think we can say, I promise you this will be a meaningful use of your time. Your commitment here in the simulation lab is about you getting better as a healthcare provider. That's what it's all about. I promise you that I will use your time wisely. The next thing, tip 3, I think we need to be explicit. We are not setting traps. We're not here to trick you. This is part of the angst of simulation, I think, that some people believe. They think that we are setting traps so that we can have them do something wrong, so that we can tell them what they did wrong. I think it's important to continue to reinforce that what we're doing here in the simulation world is trying to help you get better as a healthcare practitioner, and we're also trying to help the system get better and understand the environment that you work in and how we can create a better environment for more successful patient care. The next thing, I think, tip 4, I think it's important to say, when you experience simulation, we will have a conversation about it at the end. We will offer a debriefing, which will be a fair and equitable conversation about what happened. There are probably things we'll agree on, and there might be some things that we disagree on. But the point is to stimulate learning so that we can create a better environment to help everyone get better. Tip 5. Last thing. Now, I do a lot of work with practicing professionals and senior residents, so it can be a little bit of a sensitive bunch. But I think one of the important things that we do in the orientation for the courses that I am responsible for creating is we let everybody know everybody makes mistakes. I make mistakes, you make mistakes, we all make mistakes. And those are things that are great to happen in the simulation lab, because if you make those mistakes in simulation, it is much less likely that you're going to make them in the real patient care environment. So I hope that helps, or helps you at least think about how do you go about engaging your adult learners for healthcare simulation. Until next time, happy simulating.